Hey, y'all, and welcome back to Group Therapy. I'm licensed clinical psychologist, Dr. Kristen Casey.
I'm licensed psychologist, Dr. Jessica Rabon.
I'm licensed psychologist, Dr. J.
I'm licensed clinical social worker, Kristen Gingrich.
The gang is all here. I'm so excited.
First time in like a month.
I know. And we're all back right in time for the end of Mental Health Awareness Month. So it's exciting and sad all at the same time, pretty bittersweet. This week we are talking all about depression. So settle in, take a seat, and welcome to Group Therapy. Last week, the reflection question was, what's one thing you would tell someone who has never been to therapy? And I got to be real with y'all, there were so many good answers. I think there was 20 something, 29 or something like that. So I just picked a couple, and it was literally just the first few that I saw. So the first was, think of therapy as a form of brain training. It's a way to learn about your own brain and how it works while learning new skills that can be implemented at any time to reduce stress and suffering. That was really cool. Not all therapists are good therapists. I'm really glad that somebody said this. There are actually a couple of comments that said this. And it feels like if they're there and helping you, it's okay to, find a new therapist. Don't give up on therapy. If it's the first therapist that you have, that's not a good experience. It's hard work and also life-changing. Somebody said to write down your challenges and what you need from a therapist. I thought that was really, really insightful.
Oh, I like that.
It's not how it looks in the movies. It gets worse before it gets better. And finally, once you start to learn more about yourself and start understanding why you think and act the way that you do, you'll fall in love with the process. I love that.
I love it.
There were so many great answers. Thanks for contributing. You could view more of them on our Instagram. And just to start us off with depression, in 2020, depression was prevalent in about 1 in 10 American adults and almost 1 in 5 adolescents and young adults. So the pandemic contributed to worsening the mental health crisis. And that being said, I have a question for all three of you. Okay. What does depression feel like? And if you don't know what it feels like, maybe what do your clients express to you that it feels like?
Heavy was the first word that came to mind.
Yeah, the first thing that came to mind was like a weight. Mm-hmm. I immediately felt it in my chest.
Yeah. What about you, KBI?
I feel I take the weight, and then do you ever walk into you're in a grocery store and you walk under a vent and you just feel like that little burst of cold air? Mm-hmm. But to me, depression feels like that cold air is heavy.
Oh.
Oh.
Mm-hmm. Okay. It's noticeable enough. Yeah.
It's noticeable enough where I go, mm-hmm. and that's for me. And for me, it's sometimes, sometimes I notice the cold, mm-hmm. and sometimes I don't.
Yeah. I think it looks different for everybody. Yeah, for me, I feel like it's almost like a little cloud that follows me. Like I can see the sun, but it's too far away for me to catch the rays, and I just feel like I can't shake it. But yeah, just to start us off, I figured I would ask that, but let's dive in, let's dive into some depressive disorders. I don't know where to start, guys.
Well, I think a lot of people say depression and they think it's just one thing, but really there are a different, there are a number of depressive disorders. And I think, and you all can disagree with me, when people talk about depression, they are either talking about symptoms or major depressive disorder.
Yeah.
But there's also other depressive disorders. We have persistent depressive disorder, premenstrual dysphoric disorder for individuals who menstruate every month or not, however frequently the period comes. Even depression, I see this a lot due to a medical condition or induced by a substance or medication.
Yeah, we did our whole episode on seasonal depression, right? Mm-hmm. Everyone loved that episode. It's such a time but there are many, many forms. And I think for a lot of people out there, they wonder if I think I have depression, what are some of the symptoms for major depression? And then maybe we'll break down the other ones.
Mm-hmm. I always think it's funny it's not funny, haha, but one of the primary symptoms of depression is literally depressed mood. And it's like, and it seems like so obvious, but it is like, you know, that feeling sad, empty, hopeless, most of the day, every day. One I see a lot is that anhedonia, like the lack of interest in activities. So people that used to really enjoy sports no longer participate. I see a lot with my teens, like, oh, I used to really enjoy drawing or creative things, and they have no interest in doing those things anymore. What are some other symptoms you all think of when you think of depression?
I think of sleep issues, energy, changes in energy, like fatigue, like people just kind of feeling like I'm awake and doing it, but I'm kind of in autopilot. I know that could be a symptom of many things. That's just the one that a lot of my clients report to me, at least.
Yeah, I think of the worthlessness, increased suicidality and thinking, and just even like the cognitive parts, like difficulty concentrating, just thinking, making decisions, those types of things.
Things like decreased self-care.
Oh, yeah. Absolutely.
The struggles to just take care of sometimes your basic needs.
Yeah, I think of like KBI, I think you've talked about this quite a bit on yours, but like when hygiene starts to go, you know, like forgetting to brush your teeth or even shower and stuff like that. I mean, I think for some people, they feel a lot of shame with that. And that's technically, I mean, it could be a symptom of depression.
Well, because some of those things, a lot of times with depression, right, everything just feels like so much. And again, you add the lack of motivation, the hopelessness, and even just something taking a shower just seems like a total feat.
Even eating, and we can see that a lot with depression, like significant weight loss or weight gain, because we see a lot of appetite changes. You know, some people will eat a lot more because they find comfort in eating. Other people have no appetite or no motivation to get up and cook or even grab something out of the pantry because, like KBI was just saying, that just seems like too much energy and effort for them.
Yeah, everything like when I think of depression, everything just feels effortful. Like if I'm just doing the dishes, when I have depression, I feel like I'm doing the dishes, but it feels like I'm doing the dishes for like 10 hours. Like it just feels like so much all at once, even though it doesn't take that long.
Yeah,
With depression too, like with sometimes that everything does feel so heavy for a lot of people that need to still continue even when those things feel so heavy. And so sometimes depression stays so hidden and we don't see it because like most people, for myself, wouldn't classify me as a depressed person because I get up, I go to work every day, I take care of my basic hygiene, I take care of my home and my child. But inside is that internal weight and kind of that kind of like what depression can look like across a spectrum, because I think sometimes we can get caught in depression looks like this. It looks like holed up in your bed for 6 days. And when the reality is that is not as common as sometimes people getting up and going to work and doing those basic things as well.
totally. I'm glad you brought that up because there's so many symptoms, you know, in depression or any mental health difficulty that it is hidden. And that people think like, oh, I'd expect them, if they're experiencing the sadness of depression, they must be crying a lot. For others, they're literally coming into work with a smile on their face, right? We can talk about some of the most famous stand-up comedians who struggled with major depressive disorder. So the internal truth for individuals out there is always the most important factor. Because I know a lot of people would be like, am I really depressed? Like, but your internal truth, and that's why it's across so many categories. Like, do you find yourself withdrawing from your friends? Are you doing things you usually love and it just doesn't quite feel the same? It doesn't feel as pleasurable. Like, you look at, across so many different little avenues, and people can have symptoms that are more hallmark for them, but for another person, they don't experience that at all. And that's sort of the interesting thing about depression, but also it adds a lot of complexity because, again, it doesn't show itself in one version.
Mm-hmm. Yeah. Yeah. It's like mental, emotional, behavioral, physical, like all the different. Yeah.
Right.
And that's why I think it's probably so hard for people to talk about their depression, because I think once you acknowledge it, then you almost have to face it. And I think people are afraid of that. And on the other side of that is healing and, working through and functioning in a different way. But I think y'all make really good points, because if I look at people, even in my life, or even just, I don't know, people that I see around, I would never think that any of those people are depressed, like right off the jump. Mm-hmm. But 1 in 10 people, or whatever the stats are now, that's a good majority of people struggling, and you just don't even know it.
Mm-hmm. Well, in K10, going to something you said about people struggling to talk about it, like, how many times have we heard people say, like, what do you have to be depressed about? Like, I think there is still stigma. I know we've talked on this podcast about other disorders that are probably more highly stigmatized. But I feel like there's still a lack of understanding. So, like, what do you mean you can't get out of bed and brush your teeth? Like, that's disgusting. And a lot of judgment comes with it. So if somebody is, maybe showing up to work because they're like, I have to keep my job, but they haven't washed their hair in a month, brushed their teeth, and people start to notice and is met with, judgmental comments, that's just going to reinforce those feelings of shame, worthlessness, whatever other uncomfortable emotions come up with depression as well.
Yeah, and that leads me to thinking about, I know a lot of people ask this in lives and other places of, like, what causes depression? Like, where is this coming from?
A lot of things
P
can
told
cause
me
it.
it was like, yeah, I know. I'm like thinking back to like studying for the licensure exam, and it's like, is it genetic or is it environmental, or is it a combination of both? And what are the heritability rates? And like, yeah, exactly. Yeah. I could. Oh, go ahead, Katie.
Oh, no, I was just going to say, I think it is a combination. I think for some people, it's more genetic and biological. And I think for other people, it is more environmental. And then again, there's people who are right in the middle, where there have been clients that I've worked with over the years where it has been very much environmental. And once they were removed from a situation, that depression alleviated. But that's not everybody. And I think that's something that when we're evaluating, or even as a person who may struggle, really looking and saying, okay, what are the pieces that I have control over that I can look at to help alleviate symptoms at times, to see if there's a piece of this that is environmental.
Yeah, just working in a hospital, I see, a medical illness causing depression a lot of the time. So people with no history of any mental health concerns get a life-changing diagnosis and start showing symptoms of depression, more than just like the adjustment disorder that we all love to give at the first intake. But like medication, I have seen that too in the hospital, certain medications causing depression. We know that women are, I believe it's twice as likely to meet criteria for major depressive disorder than men. So whether that's hormones, another biological factor, if we're going off hormones, postpartum depression. So after you have a child, and, parenthood and hormones that go along with it. So there are a ton of factors that increase your risk and could potentially cause depression.
Yeah, I'm reflecting on the depressive episodes I've had, and I'm like, the most common culprit for me is actually burnout. It's like going through periods of really high stress, perfectionism, self-sacrificing, no self-care, and boom, it's weeks of here's this depressive episode. And at other times in my life, it's been due to trauma and grief. And it's like trauma symptoms can be different. Grief symptoms, of course, are different. But these different life events can lead you to having depressive episodes. And it's different than having the periodic sadness that kind of comes and goes in waves with grief versus having this cluster of symptoms that stick around for 2 weeks or more. And then, when we talk about persistent depressive disorder, we're talking about 2 years plus.
Yeah, it's wild. Because I even think about like the different varying factors that make depressive symptoms like more intense. And I think you hit on something really good, Justin, of burnout, because I think about stress, like we talked about in the stress episode of like, is your stress controllable? Like, are you able to kind of get ahead of it? Are you able to find any solutions for it? And for a lot of people, I think if they're already depressed and then they're stressed about other things that they can't control, I'm thinking of like systematic racism, discrimination, all those things. And I mean, who wouldn't be depressed if you're experiencing all that? And who wouldn't feel depression on like a really intense level if that's your life circumstances? So I think it could vary, for some people. And for some people, it could be like a lifelong thing. It could be longer than you maybe anticipate just based on circumstances too.
So if somebody comes to you all and, either showing symptoms of depression or you believe they meet criteria for a depressive disorder, like what are kind of your go-to treatment modalities? Do you all have a favorite? Is it client dependent?
I tend to be real pattern focused. Like I get curious about that of like, I want to know what arose in the here and now, like what led to this current episode. Because sometimes we identify certain trigger points. For one person, it's like interpersonal conflict. I was having conflict at work that led to conflict in my relationship. And then I felt less than. And then I kind of started feeling the slide. But for me, being, real interpersonal process and more psychodynamic, I want to know what patterns exist. I've certainly worked with people where the pattern is seasonal, where it's like, it literally is the spinning of the globe and the tilting of the axis, right? More the tilt of the axis. Don't come for me with your science. But the globe spinning is also a thing as well. But I say that to say of like, the more we can understand our pattern, what's happened now, and maybe thinking back to previous episodes, we can begin to see what our trigger points or signs are. Doesn't mean we can always stop a depressive episode, but again, the spectrum of what starts to correlate or coincide with the depressive slide is so vast. And it makes it interesting as a therapist, but it also can be really empowering when you can understand yourself better in those terms.
I like that. Yeah, for me, it is client focused for me. And in some sense, obviously we all do the assessment phase, but I do tend to think like some clients are more cognitive, like they're more in their head. They're more like have that internal monologue. Other clients are very behavioral, like, their depression shows on their body. Other people could notice. And other people are just more emotional or even spiritual. It could be connected to spirituality, in my opinion, depending on what you believe in and what the person finds to be helpful. But I always ask the clients, like, what are you telling yourself? Like, what are you telling yourself when you're in these states? And what makes it worse and what makes it better? And what were you taught about when you're feeling low from childhood? Like, did anybody hold space for you? How did your parents or caregivers or other people in your life respond when you said that you had emotions, So I like to look at a little bit of like the core beliefs from CBT, but then I like to use ACT as well. For most clients, that at least my clientele right now, acceptance and commitment therapy, really trying to figure out how to live a life based on the things that you find meaningful, I think could help. Sometimes it doesn't get to the overall root of it, but I think it certainly can help.
And really looking, at our clients' strengths as well, and finding, okay, what are the things that you are good at so that we can incorporate them when the lows hit. Because for sometimes when we get into those super low spaces, we struggle to see anything that's positive.
Yeah.
We struggle to care about anything. And so I spent a lot of time talking about like, okay, what are your strengths? What are the good things that you can see when things do get low? Not to discount the low, but to help in then maybe doing like some behavioral activation, and doing things like that to really assist.
I love behavioral activation. It's
That's
like,
what I was just about to say.
but it's a hard sell. You know what I mean? It's like a real hard sell. It's like you have to do the things that you don't want to do to feel better, even though you really hate it right now. It's like once you're in motion, sometimes it'll help.
I always talk to people about baby steps. So like, right, you're in the middle of a depressive episode and your house is trashed. I talk about like, yes, you look at cleaning your house as a huge feat. If you look at it as just cleaning your house, you're not going to do it. Versus I say, okay, why don't you just go and collect the dishes? Why don't you just go and collect the clothes? And break it down into things like categories, like small categories to start that process. Because 9 times out of 10, once you start doing it, you do get that activation after like the first 1 to 3 activities. But when you look at it as like, okay, I'm going to clean my house. Okay, I'm going to clean my living room. Well, that, depending on how bad it is, that can be overwhelming. And so instead, breaking it down into those little pieces.
I really like that because I use time-based pacing with my clients with chronic pain because they can't complete the whole activity and they could only complete like a little part of it depending on their pain and all that stuff. And I think it could be helpful for depression too. It's basically what KBI was saying. And I really like the baby steps and adding it with another thing. It's called the Premack principle. So if you have like a high frequency behavior, like just say you love to call your friend every day at the same time, just say you have a bestie. While you call that bestie, you might do other things, maybe do the dishes, you know, so that both of those behaviors increase in frequency. And then you don't even notice that the dishes are done because you're already doing something fun.
But your bestie has to pick up the phone. So when you're driving home from work and she never picks up the phone because she's working.
Always in session. My phone is in airplane mode, okay? Like, I don't know if that was directed at me, but it felt directed at me. So.
That was 1,000%
directed towards you.
Yeah.
I anytime I call K10 when I'm driving home from work, if it rings twice and she doesn't pick up, I automatically hang up because I'm like, oh, she's fucking pregnant.
I'm in session giving my clients 100%, okay? Like,
I feel like Jess and I are like
how dare you
here of like,
excuse me.
Don't interrupt. Let K10 finish.
How dare you?
Let's internalize her perspective here too.
Look, I want to settle this, but I think that we need more time to process KBI. So after the
there we go.
Do the workout outside of session. Come back next week, and I think.
Oh, and I know.
Oh, I was just going to say. I think one of the cool things, if we're going to label things cool when talking about depression, is out of pretty much all the mental health disorders, it has a lot of evidence-based interventions that have shown to be effective. So, you know, we've named a lot here. We've named ACT, behavioral activation, CBT, psychodynamic, interpersonal, and all of those have shown to be effective. So I think it's really good when we have a lot of options to meet our client where they are and also what would work for them. Because I know there's a number of other interventions that we haven't really even touched, but to any group members listening that maybe is struggling with depression, know that, you know, if you've heard CBT is for depression and CBT doesn't work for you, there are a ton of other evidence-based treatments that may help and may align with more of who you are and what you're seeking in treatment.
I think some people...
I was just going to say it, right? I mean, one of the things we also didn't touch upon was even just medication.
I was going to say that, yeah.
Right? We talk, I mean, Prozac, sertraline, I don't know what
Zoloft.
Brand name, Zoloft. I mean, those are the two, and
Lexapro.
And Wellbutrin tend to be the 3, Lexapro, like those are the most common ones that are prescribed, you know, when, you know, sometimes that those interventions may not be working to the best of their abilities to help fix maybe a chemical imbalance. I know you guys, I think you talked about this 2 or 3 weeks ago in the new sciences of mental health treatment, transcranial magnetic stimulation. That is a new treatment for medication-resistant depression that I am actually starting this week. I go for my
so
mapping this
exciting.
week for that. Yeah, it's scary and weird, and I don't know how it's going to work, but it's going to work, hopefully. But I mean, even I believe ketamine is also like just there's also even outside of, I know we're now not like prescribers, but even just outside of therapeutic interventions of a therapy office, there are other interventions as well.
Yeah, I really like that you brought this up, KBI, because when I think of medications, I tend to think of like pharmacotherapy, like doing therapy in conjunction with medications. And really depending for the person, you might have other diagnoses too that these other medications are helping for, that also coincidentally help with depression. For example, some of my clients have been prescribed trazodone. And when I worked at the VA, they would give that for sleep. It's actually an antidepressant. So it works for both technically. So I think really depending on the person, medication could be helpful. And then even if we're thinking outside the box, social support is great for people. I mean, it's not a depression cure. I'm putting it in air quotes. Getting out in nature, like there's a lot of other therapies technically out there that aren't evidence-based for depression, and stuff like that, but it could be super helpful, like yoga. I know Justin's into yoga, meditation, stuff like that.
Exercise in general.
Exercise, it could be helpful.
Yeah. I usually, when I'm working with a client, I agree. I like seeing where their strengths are, what are activities that have kind of fallen off that usually like boost their mood, just that like 1 point on the mood scale. But I'm a big proponent on let's try to incorporate things that we know have some evidence. Sunlight, having a sleep routine, like, again, making sure we're contacting friends, like reaching out, as we've already mentioned. But like, what are the areas we can make those small steps in that we know like make a difference with depression? Because again, it can happen so quickly. I know people listening can relate of like when you slide into a depressive episode, it's like, yo, I haven't hung out with anyone in a minute. I don't even remember the last time I was like out moving my body. Or like I've been in my office doing so much work. So there are a lot of different intervention points. And I know you used the word cool before, Jess, but like I tend to agree that like especially with depression, and I know we can get into treatment resistant depression later, but it often feels like making these small little shifts for people really help a lot. And there's usually a lot of different areas that we can put just a little bit more energy into.
Agree, yeah.
So know what else we want to put energy into? The Google Scholar Shorts.
Of course.
I was trying a transition there. And you all actually set me up perfectly for what
We got your back.
K10 and Justin, you were just talking about. So my question that I was going to pose to you all is, how do you believe being out in nature impacts depression?
Girl. Oh my gosh.
I was like, dude, K10 hack into my Google Doc.
I'm actually chat
I know
GPT
it's-
right now. No, I'm kidding.
I know it's good for you, but like,
It's
the woods,
It's pretty wild, like how
air,
it's
sunlight.
so good for you, actually. But
It really is.
Yeah.
Yeah.
So this study looked at the effects of a nature-based intervention in the treatment of depression, came out in 2023. And so they actually did a nature-based intervention that I had never heard of, Flow with Nature. So it's 12 sessions, 90 minutes each. And the treatment group met in different nature areas. So parks, urban and rural forests, water areas. And really the intervention wanted people to direct their attention to nature, like literally that was the intervention. And what they found is for individuals with depression, attending nature-based treatment in addition to receiving their normal treatment as usual, reduced their psychological distress, increased restorative experiences, increased self-reported work and study ability, and also decreased depressive symptoms more than just treatment as usual.
It's badass.
Yeah.
My whole dissertation was on burnout and nature exposure and like mindfulness and stuff. And it was crazy back then I'm dating myself here, but when I was doing my dissertation, there was a lot of studies out there, but they weren't like as robust as they are today. And this is just within a couple of years, and I just love that people are tuning into nature more. Because I don't know, it sounds like really weird, but like if you're just observing outside, like, I don't know how to say this without it sounding weird, but like if you're just like watching nature, it kind of grounds you in a way that's so different than any other grounding activity, in my opinion. It's not based on research, just my own opinion. I just think it's really cool.
Prefrontal cortex activation for sure.
Yes,
right there in the here and now, getting out of the amygdala. But like, what's easier? Like, I'll do a little bridge into travel, but like I've said before, if you could just pick us up and put us somewhere out in nature in some like beautiful space, it changes your mindset. But I know, like, I've been there when you're in the midst of depression, it just feels so hard. But I also know what that feels like in your brain when you're telling yourself it won't make a difference. Like, I've literally experienced that where I'm like, yo, my body's heavy. Like, well, how big of a difference will it really be if I go sit in my lawn chair, out in the sun or like hit the beach? But it's amazing, like how much of a shift it can make. Because again, your brain is sensing the environment a completely different one than the ones we tend to get stuck in.
Yeah. Well, and
I love that description.
I feel like, because we talk about so much on this podcast, how access to treatment is not accessible to so many people, but something like going outside, and yes, there is some privilege in that because some people don't live in safe areas, things like that. But, being able to walk outside, if safe for you, for 30 minutes a day, 15 minutes a day. Like I said, this treatment was 12 sessions, 90 minutes each, but I'm sure we could break that into a bunch of different ways, and just knowing that there's beneficial effects. And there's plenty outside of depression. I know, like cognition. I had a professor in undergrad who was a cognition professor, and before every test, he made us go walk outside for, I think it was like 10 minutes, because he was like, you'll come back and you'll feel a lot more focused and you'll be able to take this test better. And it was great.
I wish I would have done that before my licensure exam. My gosh. Geez, that would have been so helpful.
You mean sitting in your car just shaking isn't like a great strategy?
Just like
walking from the car to the building.
Oh my God.
That wasn't enough exposure.
And then anyway.
What I'm gathering from this study is I'm depressed as shit because I don't go outside.
And you live in Maine. Okay.
Maine is beautiful, though. Like,
listen,
my
you have no
exposure
excuse
to the outside is opening up my sunroof so I can get vitamin D while I'm driving.
Oh my God.
Like, guys, there are bears and like snakes.
Listen,
and bobcats.
I'm gonna call you out a bit. When you got back from Florida, we have the evidence from last episode.
Well, that's because I was in Disney.
Receipts.
Whoa!
You put me in Disney.
You were talking about how much you like the heat and the outdoors. I don't know.
Yeah, I like the outdoors at Disney.
You were just vibing. Well, you were outside anyway. Like, you just have to be outside. Yeah. That's it.
That just means I need to move to Disney.
Or possibly. I got it. We'll get her a VR headset, because we know from a couple episodes ago, VR works. We'll stick her outside and pretend she's in Disney.
This is so great. We'll have like heat lamps are all around her.
Stick me to a sauna, put a little bit of moisture in the air, and it'll be all set.
We got it. We got it.
No, but like, I mean, I could hike every day here, and I'm like, that doesn't work for me.
When you do it, I want you to reflect and track your symptoms. I want you to track your symptoms and do it.
We need data. Okay.
Data.
We need you to be a case study.
Data.
You need
the data.
I will write a research report if you collect the data.
I'll give a poster presentation on the research.
It's going to be Kristen is miserable. That's what it's going to end up being.
Kristen is miserable, but not at Disney.
If I'm going to sit outside, there better be a vodka seltzer in my hand, living its best life.
Not conducive to depression.
No,
No, I know it's not. But
zero
Alcohol.
Benefits of alcohol. We also covered that on the podcast.
we've already covered that too.
about
I
that.
know. I don't help myself, guys. I don't help myself.
But no, we can with the polls. Thank you for saying that, because
We
I
can.
didn't know how I
We
would
can.
transition from I can't help myself. So
I love it.
thank you all, as always, for engaging in the polls. We love this part. So the first question I asked, have you been diagnosed with a depressive disorder? The options were yes, no, unsure, or not formally, but I think I've had depression. So what y'all think was number one?
Last one.
Last.
It was actually yes, was 60%, followed by no at 20%. 18% said not formally, but I think I've had depression, and 2% said unsure.
We got some sad group members.
So
We run in the sad train.
the next question was, do you know someone who has been diagnosed with a depressive disorder? Options were yes, no, or unsure.
Yes.
Yeah, yes.
Yeah.
Yep, 91% of our group members said yes.
Damn.
Wow.
Okay. For adults to meet criteria for persistent depressive disorder, one must have a depressed mood for most of the days, for more days than not, 4, and that's the diagnostic criteria. That's why it's so wordy. 6 months, 1 year, 18 months, or 2 years. Justin already kind of gave the answer.
I gave you the answer,
I know.
listeners.
I
think our members
KBI's
know.
looking. Did you not listen to Justin giving the answer earlier?
I do. It goes in.
Do you know the answer?
Leave her alone. She has ADHD. Oh my goodness.
Way to have her back. That's right. Defend.
So what? So Justin gave the answer that the correct answer is 2 years. What do you all think our group member said?
I think they knew it. I'm going to say they knew it was 2 years.
I feel like it was either 18 months or 2 years. Yeah, something like that.
So most group members said 6 months at 69%. 2 years came in second at 18%, 1 year 10%, and 18 months 2%.
Yeah,
So hope you learned something. It is.
There
It
we
is
go.
very long.
Yeah.
Okay, so then the next question was, to meet criteria for major depressive disorder, one must experience 5 or more symptoms in the DSM-5 TR for blank weeks or longer. Options were 1, 2, 3, or 4.
They knew this one.
I feel like they got it at 2.
They got it.
Yeah.
At 2.
They did get it at 2, 49%, followed by 4, then 3, then 1.
Nice.
Okay? You can have a depressive disorder that is induced by substances and or medication. True or false?
True.
Yeah, they knew it.
True. And our group members knew that, 93%. And then the last question I
Because I
asked
paid attention.
is, what words of encouragement do you have for someone currently struggling with depression? So everybody get ready for KBI to cry, because she cries at all of these.
Oh.
She does. Last week, you weren't here, K10. She was like sitting, tearing up.
Because I'm on an emotional, guys, I sat all day in an adoption training. Like I've been crying all day. So this is going to be icing on the cake.
Crying in the
Okay.
club. It's all good.
And you all submitted so many good answers, so I'm just going to read some of them. No matter how hard it gets, keep fighting. There's a light at the end of the tunnel. You are not your depression. It is okay to ask for help. It's worth it to try to take back your life. Be very kind and gentle with yourself, and don't forget to breathe. It gets better.
Oh my God. These are so
A thought is a thought. You are not your thoughts. You are strong and brave. If you're worried about letting yourself or others down, I know it's hard. I see you. I'm here for you. I'm really proud of you. You are not alone. You are valued. I don't know if anybody
about
could
to
hear
burst.
that other than all of us. You are not alone. You are loved. You are loved. There's a lot of you are loved. Seek your sunshine. I have it tattooed on me. I like that.
Oh, I really like that.
Oh, somebody else said, if you rearrange the letters in depression, it's I pressed on. It's a quote I saw. I like that too.
Wait, really?
Yeah.
That's
Things can
I
only
love
get
that.
better if you're still here. I promise this feeling doesn't last forever. Somebody said ride the wave. It will pass. It sucks, but it does pass. I just read that for Justin because wave analogy. So yeah. Thank you all. There were so many great responses there.
Those were great. Oh my God. I'm trying not to cry right now. They were so good.
I hate feelings. It's not very bad bitch of me. God.
I think it's super bad bitch of you.
Yeah.
Embrace whatever rises.
Unbothered. I guess I should use the term unbothered.
When I see a fellow human crying in the wild, I'm like, fuck yeah. It's a strong ass bitch right
when
there.
When you're out in nature? No.
When I'm out, in nature and I'm just crying by myself, I look at myself and I'm like, yeah, you got this.
She stares into the stream.
Come on.
With leaves.
It's like a Disney movie.
Placing your thought on the leaves.
It's like a Disney movie.
Leaves on a stream.
Well, we got plenty of leaves on stream from group members. I had no transition. You left me with nothing.
I thought you had it.
I had nothing there.
Oh, okay.
We got some group member questions. We got tons of them. And we've been structuring this pod to answer more questions, which we hope y'all are loving. We love answering your questions. We're always so stoked for them. Smiley face from the Netherlands. You would be smiling over there in the Netherlands. If someone has always been depressed, like actually feeling a lack of serotonin and feeling sadness most of the time for their entire life, how can you know that you are getting better? Is that even possible?
This one has me in deep thought because I think I don't have the right answer here, but my initial knee-jerk reaction is sometimes it could be observable and sometimes it could be not observable. Like it might be, you might have to be intentional in seeking out your strengths. And I always say like journaling is so helpful, even though my clients like roll their eyes when I say, oh my God, let's journal. They're like, seriously, I really don't want to. But if you look back in your journals, you could almost tell when you were really low. And it might actually be subjectively lower than you feel now, even if you still feel low right now. So I think data is helpful, like gathering some data, asking friends or family, like, hey, when do you notice when you feel the most low? Do you notice anything observable that I might not catch on to?
Yeah, and I would, I'm pulling a Justin here. Like, how would you define better? Like, what would indicate to you that you are getting better? And then kind of like Kristen was saying, identify or seek out data. Because I think a lot of times, at least in my experience, clients will come in and their goal is like to not feel depressed anymore. And so they're looking at the end goal, which is great, but then they miss the day-to-day. So is it that you recognize today it was easier to shower, or today I ate 3 meals instead of 2? That is progress. That is showing that you are, quote unquote, getting better. And a lot of times, something I tell my clients is once you have that like evidence, quote unquote, that you can do these things, it increases your motivation to continue to do them. And also recognizing that it's not going to be linear.
Love that. Love that. Jeremy from Maryland. Are they always merry up in the land? We don't know. Is there any relation to having a natural delayed circadian sleep cycle? This question is geared towards someone in particular, and susceptibility to depression. And to add to it, P.S. Team Candy Corn. Jeremy.
I'm talking about. Jeremy knows it. Jeremy knows.
I was about to say, Jeremy's sucking up, so K10 answers this question. No, I'm just kidding. We love you, Jeremy.
Jeremy, you are amazing as you are. You don't have to suck up. But so there's no, if I think about the research, there's like a really, really small correlation with that specific disorder. I'm thinking of delayed phase sleep-wake disorder. It's like a circadian rhythm disorder where your body clock is just delayed a little bit. So you're waking up later and going to sleep later. And for those people who are technically night owls, could they be more depressed? Sure. I think it depends on the person. But I think it really depends on the person themselves and what they're experiencing. Because I think about it this way. If you're awake when nobody else is, and then you're sleeping when nobody else is, you're going to inherently feel like some sort of polar struggle, with that. And could that make somebody depressed? Sure. So I want to answer in black and white terms, but I really can't. So I guess it depends, and really depends on the person. For example, my brother is a night owl, and he goes to sleep super, super, super late, wakes up super late. And he would tell me, like, I'm not depressed, but I do feel kind of low because when I want to do things, nobody's awake. So for him, it's more social. For other people, it might be, more of like the sleep wake cycle with your circadian rhythm. So you might be getting sunlight at different times, or really not at all, depending on how late you're waking up. So sunlight matters too. I hope that answered your question, Jeremy.
What's sleep?
Well, it certainly is going to have to, because the three of us got nothing. Mo from Jersey. Is the link between suicidal ideation and depression, or what is the link between suicidal ideation and depression? Do you need to be depressed to have suicidal thoughts? And are suicidal thoughts the natural rock bottom for depression? Great question, Mo.
I do think that I think that there is a link. I don't think that it's always the link. Because there are many people, who get medical diagnoses and start having those thoughts, and maybe they wouldn't classify themselves as depressed. But there is a high correlation between suicidality and depression. What was the third part of that question?
Yeah, are suicidal thoughts the natural rock bottom for depression?
I can say for some people, yes. I would say for some people, yeah. I mean, not everybody who reaches rock bottom of depression, or their rock bottom, because it's variation for each person. There are people who are severely, severely, severely depressed who have never really had a suicidal thought. Then there are individuals who are in the same boat but do have suicidal thoughts. So again, I think that varies for person to person in, what is impacting their depression, what is their life looking like, what do they have means to even carry out those type of things, and also what are the protective factors on the other end. So someone could be severely, severely depressed but have many protective factors for suicidality that keep that kind of in check in a way.
Totally. Yeah, it's interesting to think about. Suicidal thoughts can be very subjective to how much they are bothering a person. I know there's so much stigma surrounding them, and there certainly is, like, for people who are not in the mental health profession, because as a mental health professional, you talk about suicidality all the time, you're assessing all the time, like it's just common day to day. But people can have, passive suicidal thoughts that are pretty rampant in terms of their, like, everyday. But that's not actually a symptom that really bothers them. The thing that really bothers them is when they go to play video games, like, they feel nothing. They feel no joy. And they're like, I just can't get any joy and pleasure out of anything I'm doing. So as KBI said, it's interesting to think about a rock bottom for somebody within any sort of diagnosis is very subjective, because it depends on, like, what symptom for you is most bothersome. And again, it varies vastly from person to person. Vanessa from the UK. What would you advise to people who likely have depression but can't access mental health services due to horrendous waiting times / lack of services in their area?
Oh man,
Well, we talked about nature, but
right,
yeah.
we did.
Yeah.
We did.
I mean, usually when I think of, what does your depression look like? And if your depression is so bad that you're not able to engage in those basic self-care, that's going to be first step. Like, are you eating whatever your normal is? Are you brushing your teeth, bathing, moving your body in a way that feels good for you? If not, I would start there. Once again, doing those things might not necessarily cure your depression, but if you're, one, doing those basic things, it can make you feel better. And two, I would argue, and you all can disagree with me, if it's too hard for someone to get out of bed, asking them to engage in like higher order cognitive activities or even like journaling probably seems even harder. But outside of that, like we talked about behavioral activation, you know, scheduling innately rewarding, pleasurable activities that you need to do. You can do that on your own, really. So like if you know, I really used to enjoy painting and I haven't done it before, like setting aside time each week to do those things. I don't know, listening to podcasts, seeking out social support. And I mean, I know this is all easier said than done when you're feeling really depressed, but there are a lot of things that you can make sure you're doing in your daily life that can help relieve some of those symptoms.
Well, and these are some of the things that if you would see a therapist, they're going to recommend to you as well in treatment. Yes, there's obviously intervention. Some of these things are going to be things that are automatically going to be recommended to you when going into treatment.
Yeah, and to your point too, I mean, therapy will like, quote unquote, a therapist will like prescribe something, right? Like, hey, you know, this is CBT, this is that, and all that stuff. And they basically hold you accountable for that. And I think of it this way, like, you're going to have to do the work outside of therapy anyway, so you may as well just give it a good start, you know? And I think with expectation management, you're not going to really want to do any of this stuff. But I always tell myself, I'm going to try to show up and then give myself an opportunity to say no once I've started, like give myself an out, but I have to at least give it a good go and just try it, whether it's going for a walk or anything like that. And to your point, it's not going to cure it, but it might make you feel like 5% better than it did before. Like KBI saying baby steps, I think are helpful.
Love it. Katie from Virginia. Sometimes it feels like the idea that I have to take a medication to operate like a neurotypical individual plays into my depression and my overall belief that I'm not good enough. Do you have any advice on how to navigate accepting those thoughts and feelings surrounding medication? Thank you. Love the podcast.
I actually struggle with this one personally. Go ahead, Jess.
No. You go ahead.
Real quick. So when I started medication a long time ago, I kept saying like, oh my gosh, I'm like throwing in the towel. Like I have to like give myself up to like medication basically. But really what the struggle was for me personally, and Katie, I don't know if you'll be able to relate to this, but hopefully it helps, is there's a difference between accepting and agreeing with the situation that you're in. So acceptance is like ending the war in your mind that you could have done anything different to make this outcome any different. And agreeing is like you checking the box and consenting, like, yes, I absolutely love this. Like you could hate it all you want. You don't have to agree with it. But I think kind of coming to terms with, hey, this is what I might need right now for the situation, I think kind of alleviates the shame that might be associated with taking meds. And if we could treat ourselves nicely while we go through a hard time, I think it's the least that we could do for ourselves. I've done that, and that seemed to help for me just on a personal level.
All I was gonna say is kind of trying to identify where this belief that taking a medication is whatever it's bad, wrong, whatever you have, whatever belief you have, comes from and why you feel that way. Because obviously it makes you feel like you're not good enough, and that in turn plays into your feelings of depression. And a lot of times I do this with clients where if they can't see or identify it within themselves, like, would you tell your best friend, your partner, a parent, you know, that they're not good enough because they're taking medication for their mental health? What would you say to them instead? And, you know, I think what you feel is actually pretty common. Like a lot of people see medication as like, I'm broken in some way, or, you know, everything K10 already said. But I think navigating why you have those beliefs and working through those could be helpful to maybe reconceptualize that, you know, this is something that is helping me, or I feel more like myself or the person I want to be on this medication. I don't love the idea that I have to take medication to get there, but how I feel off of medication is impacting X, Y, or Z, not who I want to be, etc.
Kara from Arizona. Can major depression be diagnosed in a person with PTSD, or would it fall under PTSD symptoms? And correct me if I'm wrong on this, but I was under the impression that you can be diagnosed with a depressive episode pretty much no matter what. If you meet the criteria for going over 2 weeks, having the cluster of symptoms more days than not, that even if you have a diagnosis of PTSD, that you would have PTSD and a major depressive episode.
Yeah. Because I think it depends on the origin too, potentially. So if like PTSD is based on that one or several traumas that you have and you have that diagnosis already, this depressive episode might be connected or even not connected at all. And regardless of that, I agree with you, Justin. I think it could be diagnosed separately. And it probably should, just for people to discern like, hey, my PTSD might be, lower in intensity, but I'm still feeling like really depressed, and then that might not capture, if they just had the PTSD diagnosis, wouldn't really capture all their symptoms.
Totally. Sort of related, Lily from Germany. What can we do when our depression is most likely linked to trauma? Flashbacks and traumatic events themselves have caused some of the worst depressive episodes for me. And also, what can we do when it is probably our depression that's sometimes making us feel like things won't get better? Great question, Lily. What would you tackle first here, or how would you tackle it? Where do your thoughts go?
So I'm going to say the most therapist answer ever and be like, I would ask what is impacting their functioning the most, or what they want to work on the most. But I would say, Lily, if you know your depression is most likely linked to your trauma, working through your trauma should in turn help your depressive symptoms. So I would argue that really doing some trauma-focused therapy, whatever modality works best for you, likely would help that. Because if you're not addressing the underlying source of the symptoms, you can manage the symptoms. But until that source is really addressed, it's probably going to be hard to work through it to the level that you want.
Anonymous from the great region of the Midwest, from Ohio all the way out to Missouri, and there's probably some southern cutoff state that I'm unaware of at the moment, but you get the point. Up to Canada. That's the region. See it in your mind. Is it still depression if I can be functional at work and be fine in front of other people?
Yeah, and I think, Anonymous, what your question highlights here is the kind of perception people have of depression that, and I know KBI talked about this earlier, that's the person, balled up in their bed, not able to get out. And while that is the reality for many people, there are many people that are very functional with depression. I mean, I think about, my probably first major depressive episode in high school, and I just threw myself into school. Like I made great grades, I was in sports, but then I got home and literally was not functional. But I was doing in front of everybody else looked the same old me. So it is absolutely, your depression is absolutely valid, even if you are functional at work, because depression looks different for everyone. And I think it's also really important to talk about functional depression. That's not an actual term, to kind of have these discussions and break the stigma about what depression looks like.
Jennifer from, I don't know why I said Jennifer so weird.
I was wondering that.
Enunciation of Jennifer.
Jennifer.
But it was like, I don't even know how you said it.
Yeah. Because I already started in my mind saying California, and somehow I can't wait to hear that.
Oh my God. You mashed the two.
I was. What are some tools for overcoming circumstance-based depression, such as someone who has a chronic illness who's experiencing depression due to symptoms and the grief and isolation associated with that? Really good question.
So for my patients that I work with chronic illness and depression, if there are support groups in the area or online, that is honestly a first step that I suggest. And there's not always local support groups. So online support, even like through social media, like Facebook groups. I think, Justin, you said in a really early episode, like one of the only reasons you have Facebook is for like the groups for your medical diagnosis. And so that's a good step. Honestly, I do a lot of like ACT and values-based work with my individuals who have chronic illness, identifying what's important to them in life and how they can still live in alignment with those values despite their chronic illness. What things don't have to change, what things do have to change, and allow yourself to grieve. Having a chronic medical condition comes with a lot of grief, and it is okay to grieve the life you had, the life you thought you were going to have. But really, if you can find some support, and it might not even be people with the exact same chronic illness as you, depending on how rare it is, but even just the chronic illness community and knowing that there are other people that understand what you are going through can be so instrumental in helping you work through some of your depression.
Yeah, I totally agree. I know I've talked about it, having Chiari disorder before, but that was the number one coping tool for me. Like literally just being in these Facebook groups and being able to have a place where I can vent, ask questions, like be there to support other people. It's like when it's consuming so much of your world, like, and no one around you can relate to it, it just feels isolating. But we know in general, isolation and loneliness in any capacity is one of the worst things for our mental health. So I'm just doubling and tripling down on what Jess said of like, find yourself some sort, Reddit, wherever you can find yourself, some sort of support group. Senzi, such a cool name, from Arkansas. How do you deal with family members that don't believe you have it, even though you've been diagnosed with it being depression?
And for everybody, it's just so different depending on, I'm always so hesitant because I think sometimes it depends on not only your family dynamic, but culture, support system, housing, finances, right? So if you're living under the same roof as some people who don't believe you, I mean, it's not like you could just be like, this is it and I'm leaving, bye. Like, you don't have a place to live after that. You know what I mean? So I think really trying to figure out how you're feeling about their reaction is first, because you could do that internally of like, their narrative about this doesn't dictate technically if I have depression or not, because I have evidence, and whether or not they believe it is kind of up to them. But then kind of dealing with the grief and the aftermath of that, and maybe the rupture of the relationship, I think is the hardest part of like, wow, can I trust this person again? So I think it really depends on a lot of different factors, but I just want to kind of validate how like tough that is. You know what I mean? Like to just kind of experience something like that. And just because somebody else doesn't believe you doesn't mean it's not true. So.
Anonymous from Pennsylvania, what's the difference between cyclical depression and treatment-resistant depression?
So my understanding is that cyclical depression technically happens in cycles. Like it comes for a certain amount of time, and then you have like a little bit of remittance, meaning like you don't notice or experience the symptoms, and then it comes back again. And then treatment-resistant depression might kind of be around despite any treatment that you have. It might not come in cycles. You might have like 1 or 2 episodes, or you might have it in cycles, but regardless, treatment doesn't technically help. Like certain treatments don't help. But we've noticed even in our other episode, like KBI was saying, there's a lot of different treatments for resistant depression. The one that I've researched the most is mindfulness-based cognitive therapy for recurrent depression. And that's, oh my gosh, that's been really helpful for some people, although it's not really talked about as much as the others.
Totally. And has one of the best, as far as treatments are concerned, reduced relapse rate of preventing someone from sliding back into a depressive episode. Did you just say that? Did I repeat what you said?
No, you added to it very eloquently and in a very nice way. Give yourself some credit.
Part of me, I just had, maybe I heard it in my brain. It was firing in my brain as you were talking about it. And I'm like, wait, did she just say that?
Was it your internal monologue?
Ooh, it may have been.
I don't know. We talked the other week about whether that exists. And I'm like, I don't think I have that.
No, because I think you and I, we research a lot of the same stuff. So I feel like sometimes when you say something and I respond, I have the same thought. I'm like, did I just say what he just said? So we're good. Yeah.
I mean, we got the exact same tattoo sleeve. I saw you had it and I went and I was like, I just want what K10 has. And they're like, oh, a number 7. I was like, that's it. And
that's it. Hey, I knew you copied me somewhere.
Delicious. Courtney, another person from Maryland. At this point, wait. Jess, are you the only one without tattoos?
You have asked this so many times. I do have tattoos. Goodness. They're just significantly smaller than the rest of you.
Jess has baby. Is that what they get in South Carolina? Is baby tattoos?
Baby tattoo. I am not getting tattooed in the state of South Carolina. It wasn't legal until I was in college to get tattooed in South Carolina. I don't trust.
Wait, whoa, a conversation for another time, but nonetheless, what the hell?
I think it became legal in 2007 or 2008.
Wow.
To tattoo in the state of South Carolina. We have sunshine and warm weather down here, unlike in Maine.
And great beaches. Let me just add to that. And good
Solid
barbecue.
beaches.
I love mustard-based barbecue.
My God.
Mustard base is technically North Carolina. It's fine. I prefer mustard base too, though.
Gosh, I don't even know. Let's just call it Carolina. I don't want them to be separate anymore. I don't know which one you're in anymore. I can't ever remember. But Courtney from Maryland.
That's the worst friend move ever.
I'm sorry. I know you're in North Carolina.
I'm in South Carolina.
No. Listen.
I'm done. I'm logging off. What the hell?
I don't think that's true. We need to check. We need to double check that.
Also, because I double check everything I did, I lied, and it was 2004. I was not in college in 2004 yet, but in 2004 is when it was legal to tattoo in South Carolina.
That's so wild.
Yep. Anyways, Courtney from Maryland.
Courtney, we're still, it's okay. We'll answer your question.
We're hanging in here, Courtney. At what point, and this is a good one, at what point do you contact your therapist in a depressive episode? I know it's before the suicidal thoughts, but when do you all advise clients reach out? I was off the jump. I'm just wondering, Courtney, do you mean reach out as in restart therapy? Are you actively in therapy with your therapist? Because I guess I was trying to interpret what you
or maybe talking about in between sessions.
In between sessions,
potentially.
Is that because if it's in between sessions, therapists can vary a lot on this. I mean, we assess risk, meaning is there imminent danger that you can't keep yourself safe anymore? A lot of times therapists will advise in those situations to call 911 first, because a lot of therapists aren't on call 24 hours a day. But there's just a lot of variation there if it's in between sessions. I don't think I can speak on behalf of all therapists, but if it's not in between sessions, you should reach out. If you're ever thinking about maybe I should hit up my yes, the answer is always yes. You should hit up your therapist, book a sesh.
And the only thing I would add to that is if we're thinking in between sessions, and maybe you drop down to monthly or every other week, maybe the conversation is, hey, do you have availability to increase my sessions? Because if you've been thinking about reaching out more frequently between sessions, that might be an indicator. More frequent sessions would be beneficial.
I like that. Yeah, I even tell my clients too, even if we're on an every other week or a monthly, and you just want to meet for a 30-minute in between, we could totally do that too. Just to kind of get a little refresh in between our sessions, depending on just how severe things are. Some people don't want to meet. I do 45-minute sessions, but some people don't want to meet for the full 45. They're I just need a check-in, a 15-minute or 30-minute. And I'm that's totally fine, especially if there's like passive SI or even just like on that border of active SI, you know?
Bradley from all the way across the pond in the UK. From my own experience, my biggest struggles with depression are self-blame for how I'm feeling, leading to self-loathing. In your opinion, what would you say is the best way of dealing with the guilt and self-blame, which are so common? Also, love the podcast. You guys are great. But which one of us is the greatest, Bradley? That's the real
It's obviously
question.
me. I'll take it. Thanks, Bradley.
All right, K10, done. Moving on.
I'm kidding. I'm joking.
We solved
I'm
the
joking.
mystery.
I know we're all so cool.
I mean, we did have that. What was it? 3 episodes ago? I think Ray was like, "Love the podcast, Dr. J."
So it was all about Justin.
I think part of that message got cut off is what happened. It was a list of names, but what do we do about this guilt and self-blame? I was gonna kick us off by saying I think accepting that it's a part of depression.
Yeah.
Oh yeah. Yeah. And I don't know. I mean, when I think of guilt, I think if I'm really thinking deeply, guilt means like I'm making a mistake. And I think when I think about depression, a lot of people think like my existence isn't valid or it's a mistake or I feel like a burden. And sometimes that's actually shame. Shame means like I am a mistake or I am, you know, a burden or something like that. And I think a lot of people overlook that is part of feeling really depressed. I mean, you just kind of feel, and it might be like a tail end way of saying like that could be part of worthlessness and feeling just that really low sense of like, gosh, like, is this worth it? But I think it's so hard to not only experience that, but then even verbalize that to your therapist. I mean, it's a really vulnerable thing. But yeah, normalize it for depression, I think is helpful.
And depending on the client and, you know, the modality I'm using, this is where I might use some like cognitive behavioral strategies. Like, you know, I'm very on board with accepting that self-blame, guilt is part of depression. And since it's leading to feelings of self-loathing, is focusing on the self-blame, you know, sitting in that, continuously blaming yourself, helpful for you. And I'm not, you know, I'm very much of the CBD camp of not changing every negative to a positive because that doesn't work in my opinion. But like, is there a more like neutral way to kind of conceptualize, you know, I feel guilt, I'm blaming myself and this is not helpful for me. So instead of blaming myself, is there a behavioral strategy that you can use? Is there something that you can tell yourself? And obviously this is going to vary from person to person. That is not, you know, so out there that you don't believe it, but also more helpful. You know, this is part of depression and I could do X, Y, and Z to help me work through this, etc.
HJ, small town Idaho. Wow.
Whoa.
Unrelated, but completely related. I watched a House Hunter episode the other night, and the housing market in Boise, y'all, I had no idea.
Wait, what? Wait, say more.
I don't even know what that means. Like, you had no idea. Like, what
is it?
$100,000 for a 3-bedroom home that was a semi fixer-upper. Wow.
Wait.
Boise. Apparently everybody from California has moved there and has drove up. Unrelated to this mental health pod, but I was shocked that
maybe people are going there for their mental health. Like, we don't know.
Boise. People love Boise. Back to HJ here. What have you found helpful, if anything, managing your own depression and working in the mental health field? I just started my career in social work. Yeah, I think for me, since burnout tends to be one of my biggest triggers, it's doing the things that keep me afloat. And for those things especially is I'm a highly social person. If my social connections start dropping off consistently, I will start to feel low. Like, it doesn't take much for me. And you know, me working in a private practice on my own, even content creation is oddly isolating because like I don't interact with a lot of people except through comments and stuff like that. But the in-person interactions for me is something that I have to be real intentional about. And exactly what KBI was saying about like exercise, movement, is so important, like getting outdoors. But there's something particularly draining about being a therapist and oddly isolating where you're absorbing people's emotions, thoughts, narratives all day long. And then you have to ask yourself, like, who's making space for me? So that's why so many of us practice what we preach. We get our own therapy, but that social connection where you can be, raw, vulnerable, and open and not just be holding space for others is really, really important.
Mm-hmm.
Because like we're professional secret keepers. It's not like I could go and be like, these are all the clients I saw all day and these are their problems. And this is what, like, you almost like live in a vacuum in many ways. So it's so important to like have that face-to-face, even if it's on FaceTime, like with friends, family, anything like that, that helps for me. Cause I'm only telehealth. Like I don't leave my house for work. And by the end of the day, I'm like, I got to get out of here. Like I got to go do something, like I got to go for a walk or something like that. And that helps me too.
Mm-hmm. I think a big thing for me is boundary setting. Boundaries with, I think I've mentioned this before, not checking emails once I'm home, turning off my work phone, things like that. But also just boundaries around, working in the hospital. If I get 4 new consults in a day, plus the other patients I already have, telling the medical team, hey, this is probably going to have to wait till tomorrow, or like, no, I can't see them today, or this is not an appropriate consult. And I know that's very specific. And KBI alluded to this a little bit with routine, but like for me, keeping a routine and schedule is really, really important. So I know I've mentioned this on the podcast and we were joking about it before we hit record, but I get up very, very early to work out because that sets my tone for the day. If I do not work out before I go to work, other than when like my body's really tired or I'm sick, but if I'm feeling well and I don't work out, my day is thrown off because that is something that helps get my endorphins going, gets me started for the day. Having a schedule at work and after work and things like that has really helped me kind of manage my emotions and mood.
Well, our time here comes to an end, group members. I'm really happy that you spent time with us today talking about depression. We really, really enjoyed all of your contributions with your questions. We hope you enjoyed it. And as Justin was mentioning, we're going to be spending more time answering your questions in future episodes. So feel free to like, subscribe, and share this with someone who you think might benefit from learning about depression. And we leave you with this reflection question that will be on our Instagram. What is something that you do that helps you cope with depressive symptoms? So head to our Instagram. I'll also put it on Twitter. And we will see you next week in group therapy.
Bye.
Peace.
Bye.